The next section is genetics and inherited diseases. So we're still talking about autosomal dominant disorders. Here's Apert's or Apert syndrome. Here are some really good pictures. You can see the extra teeth clearly. You can see the way the child has a syndromic appearance. Very good pictures to remember, to help you remember Apert's syndrome or Apert syndrome. Appalachian Mountains in the intro mnemonic. So remember Appalachian Mountains, Appalachian Mountains. Here's another part of the mnemonic. This is Apert syndrome, in which the head is shaped like a pear due to early suture closure. Now imagine the pear-shaped head being held by hands that look like a duck's bilateral webbed hands. So there's a little drawing here for you that can also assist you in remembering. Now notice that the child in this picture doesn't really have a pear-shaped looking head, not from this picture, but you can see the extra teeth, and there's some other, hypertelorism that's also apparent. So let's talk about Gardner syndrome. Part of our mnemonic talked about Mexican gardeners. So we're going to have a primary finding in Gardner syndrome, or also called Gardner syndrome, is the malignant polyps throughout the intestines. Other findings include supernumerary teeth, which is extra teeth, and tumors in other parts of the body, especially benign bone tumors such as osteomas. This is a picture here shown of extra teeth. So imagine a psychotic Mexican gardener using a machete to harvest colonic polyps that look like red onions from Garden of Death, pre-malignant, along with bones and teeth. So the machete represents the need for surgical resection of pre-malignant polyps. A primary finding for retinoblastoma, which is an autosomal dominant disorder, is leukocoria. This picture shows it very clearly. You see the one white eye. There's an increased risk of osteogenic sarcoma or osteosarcoma of a long bone in the future in children that have had retinoblastoma. The inheritance pattern is actually confusing. There are strong genetic components, but it's also a high rate of spontaneous mutations. Here's a pearl. Avoid completely discounting just because there is no family history retinoblastoma. It's a prime example of a disorder that occurs due to spontaneous mutations. If you're given information about chromosome 13 and an eye problem, or you're given an x-ray of a long bone, such as a femur, a tibia, a humerus, radius, ulna, consider this diagnosis, retinoblastoma. So we're going to take an activity break, go over some of the things that we've just discussed. So I've listed for you the first letter of a number of the disorders, and I'd like you to take this as an opportunity to try to write down all of the autosomal dominant disorders that you can think of. Use the first letter as a key to remember. Use the mnemonic that we learned in the beginning and several of the other mnemonics that we've covered to try to get what the disorders are. Take a few minutes to do that right now. So let's try to look at the answers so we know what they are. Okay, the A stands for achondroplasia, Apert's. The G stands for Gardner's. The H, hypertrophic cardiomyopathy, or Huntington's. The M for Marfan's. There's a lot of N's, 3 of them. Nail patella, Noonan's, neurofibromatosis. The P is for Peutz-Jeghers, remember the Mick Jagger. Retinoblastoma, tuberous sclerosis. V stands for von Willebrand's, and the W for Waardenburg. Okay, we're going to shift gears a little, and we're going to move on to the autosomal recessive disorders. So the autosomal recessive disorder mnemonic has some overlap with diseases that start with the letters T and A from the autosomal dominant mnemonic. Please ensure that you have solidified in your mind that tuberous sclerosis, achondroplasia, and Apert syndrome are autosomal dominant disorders before moving on. So, tuberous sclerosis, achondroplasia, Apert, autosomal dominant disorders.